These workers seem to have run out of patience barely a week after complaining about the salaries being owed them. This time, they locked up all entrances to the Central Hospital premises. These people who have come to either seek medical care or visit sick relatives can't gain access. The protesting workers are not willing to budge unless their demand for the payment of their salaries is met. The salaries range from 10,000 to 15,000 naira monthly.
We are suffering for our money. Let them pay our money. Understand? For how long? For how long are we? 7 months or 8 months. Let them pay us. Our elderly, they are tired. Enough is enough for the wise. No money to pay. Let them pay us our money.
The permanent secretary in the Ministry of Health and some labor leaders from the state prevailed on the protesters, who eventually opened the entrances. Shortly after that, the Edo State Commissioner for Health, Dr. Ayanuwa Irege, arrived and went straight into a closed-door meeting with labor leaders. The Edo State NLC Vice Chairman, Mr. Sani Osanyade, addressed the angry workers after the meeting.
We governments have decided that this issue will be looked into quickly because of the uprising of these casual coming up, because it's a social embarrassment to Edo State government. Know fully well that the comrade governor is a man of principle, a man that wants to do things rightly. And you can see there is progress in the state, and you all will not be exceptional. The comrade governor asked Labour to look into it critically for those of us that are actually working. But the only thing we need to do for us right now is that we are going to bring peace to it while you bring peace to the hospital.
Amongst the patients and relatives gathered, one of them raised his voice to complain about some of the items he's been asked to buy, but which can't be used because the theatre is not in use.
I spent less than 50,000. I tell him that they are not going to return this thing. People should not come out to.
Outside the meeting room, the Edo State Commissioner for Health, Dr. Ayanuwa Irege, said government is doing everything possible to address the issues raised by the workers.
All the various issues concerning the hospital, not only Central Hospital, all the hospitals in the state, are being dealt with holistically.
When asked about the theatre and the patient's complaint, this is what she said.
I have not substantiated what you are saying. Whatever information I have, what I am doing now, what the government is doing is based on the information we have. So if you say the theatre is not working until I get the information and we go into it to see what the problem is, I cannot comment on that.
As the Edo State government continue efforts to develop and transform the state economy, it is also important that issues concerning the health of the people should top its agenda. This way, it can guarantee good health and a more happy people.